then my work is done. So basically, cervical cancer is when you have basically abnormal cells that have entered into the bloodstream. In my work, that have entered into the bloodstream. Now, as you would know, that is cervix. The cervix is the neck of the womb, so that's the area that dilates when we have birth, and so when first it starts off with precancerous cells. So if some women may have experienced this, they may have experienced an abnormal pap smear. And that is the importance of preventing cervical cancer is screening. Just to let you know that cervical cancer is the #1 cancer in the Bahamas of the female genital tract. Now, breast cancer is #1. However, that's not really considered the female genital tract. So when we look at the female genital tract, being the ovaries, the tubes, the uterus, the cervix, the vagina, the vulva, it is the #1 cancer of the female genital tract. And in doing some research the other day for a forum that I'm putting on next week, I actually found out that so the deaths from cervical cancer, the Bahamas rates 91 in the world. Okay, so of all the countries in the world, we rate 91, which is pretty high up. And I think most of it is due to lack of knowledge, and for women not screening and not knowing basically what the cause is and how to prevent it. So my aim basically over the last 5 years has been to just raise awareness of what cervical cancer is and how to prevent it. So basically, well, before I go on to that, let me let you know what the cause of abnormal pap smears and cervical cancer. And most women that I see in the public clinic, in the oncology clinic at the Princess Margaret Hospital, most of them are unaware of the cause. They just come to me for because they're referred for an abnormal pap, either from the outside clinics or even from some private physicians are referred to the oncology clinic at the Princess Margaret Hospital. And the majority of women do not know that cervical cancer and abnormal pap smears is caused by a virus, a sexually transmitted infection called the human papillomavirus. And the human papillomavirus is also the same virus that is responsible for genital warts. Now, there are several subtypes of the human papillomavirus. And it was found that they basically number them. And type 16 and 18 are the more common subtypes that cause cervical cancer. And 6 and 11 basically are the ones that cause genital warts. Now, there are other subtypes of cervical cancer. Some of them also cause cervical cancer, but a lot of them, there are over 100 subtypes, a lot of them are not cancer causing. It's just a virus that you get, okay? And so for women, now, just to let you know, the human papillomavirus can also affect males, because a lot of times men feel as though, oh, cervical cancer is just a woman's thing. And yes, it's a woman's thing with respect to the fact that it affects the cervix, but the cause of cervical cancer can also affect men. And if a woman has an abnormal pap smear and has HPV, then her partner has HPV. Now, where they got it and how they got, I mean, we know how they got it, but where exactly who, because it's a sexually transmitted infection, it's difficult to tell where it came from, especially if you had more than one partner or your partner had more than one partner. That's what sexual transmission is all about. But suffice to say, men are also affected because they can develop penile cancers from the human papillomavirus. They can develop cancers of the anus and the throat. And women also can develop cancers of the anus and the throat. So it is, yes, labeling it cervical cancer, yes, but it can affect other areas of the cause can affect other areas of the body, and men are not exempted. Hence the reason why um, they came up with a vaccine for, well, the first vaccine basically covered those four subtypes that I mentioned, two being the subtype for the genital warts, which is a 6 and 11, and the other two types for 16 and 18, which basically causes cervical cancer. But another vaccine was developed over the last maybe 10 years or so, the Gardasil 9, which basically covers an extra 5 subtypes of HPV. So with the vaccine and screening for women, it's possible to prevent cervical cancer. Now, cervical cancer, I want to say emphatically, is preventable. And it is preventable by primary and secondary prevention, which is 1, the vaccine, and 2, screening with your pap smears. There has been a campaign for some years now where the vaccine, the HPV vaccine, has been offered to school-age children around average the age of 11. So that's like around 7th grade. But you can give it anywhere from 10. Some have gotten it as late as 15. But the whole reason for wanting to vaccinate girls and boys at that age is to prevent cervical cancer in the future. So they're in hopes, actually, they were hoping to get the young people before they actually become sexually active, in hopes to eradicate cervical cancer in future generations. And that is my hope and wish, because cervical cancer is a very, well, any cancer is not good, but I've worked along with women with cancers of the reproductive tract, as I deal with prevention, or the preventative side of female cancers at Princess Margaret Hospital. And I see a lot, I diagnose a lot of them. And I often see them come in and out of the hospital for transfusions, for infections and all sorts of things. So my drive and I've actually formed an awareness group called the Bahamas Cervical Cancer Coalition, mainly to raise awareness first thing, and to try to get corporate Bahamas, the Bahamian people, aware of the scourge of this condition, but not only that, the economic burden that cervical cancer has on the Bahamian community or society, because um, depending on the stage, and there are 4 stages of cervical cancer, um, it can be very costly to manage a patient with cervical cancer. And for women who are early stage, where they're candidates for surgery, that's probably the cheapest, the cheapest way to treat is via surgery. And when you now talk about the later stages, stage 2 and more, you may be looking at things like radiation, chemo, radiation, and that can be very expensive. Not only that, I think radiation is like more than $10,000. And the average person can't afford it. I know that the government for Bahamians cover a good majority of it, but I have actually seen women die because they can't afford. I think they have to come up with $5,000. They can't even afford that. And so to me, screening and getting your vaccine will definitely prevent having to have to go through the cost and all of the management that is attached to actually to cervical cancer. So in addition to knowing what the cause is, it's important for persons to know what risk factors are. Now, I know most cancers, breast, colon, and all of those, is related to lifestyle, diet, and that type of thing. And the diet and lifestyle comes more with persons who actually have cervical cancer, in terms of if they're being managed with chemo and radiation. Of course, diet and exercise is important to maintain a good immune system, because chemotherapy does pay a toll on your immune system. But there are risk factors, or there are risks that increase. There are increased risks that I think that you should know about for cervical cancer, and the first being age, and your age of sexual debut, or your sexual career, and the amount of partners is definitely a risk. They are risk factors. So the earlier you start with your sexual debut, then the longer you will have been, or your chance of being exposed to the human papillomavirus increases, as well as multiple partners. But I must, of course, the more partners you have, the more your risk is increased, because you will become exposed with multiple partners. However, that does not mean that with your first partner, you cannot contract the infection. So, I have women come to me. I remember I often tell the story. I have a patient that came from one of the outside clinics, and she was very guarded because I don't know what they told at the clinic, but eventually when she opened up, when it took a more than a visit for me to get her to open up. She said, how they spoke to me about cervical cancer, they made me seem as though I run around and I'm a bad person and that type of thing. And I had to explain to her, and I want to explain to my women out there. Having an abnormal pap smear or cervical cancer does not mean that you run around and that you're a bad person. Of course, back in the day, they used to call them the women of the night. Prostitutes are more at an increased risk of developing cervical cancer. Of course, if they don't use condoms and so forth. But it's not to say we're judging you, and a lot of times when you come to the clinic at PMHC Oncology Clinic, I am going to ask you those questions, but I'm not asking you those questions to make you feel like you run around or you're a bad person, but I'm asking you those questions to determine what your risks are for cervical cancer. And I tell patients that I'm only asking these questions to determine what your risks are. And so along with that too, a history of any sexually transmitted infections, especially HIV, is an increased risk of also contracting the HPV virus. And then there are things like smoking. Smoking makes the cells more susceptible to HPV infections. And there's also for patients who have a family history. Now, we do, as I mentioned earlier, know that the cause is HPV, but there is a small subset of patients who back in the day used to use a particular drug for preterm labor. What it is? DES, yes, that used to be a drug used back in the day with our parents, probably now in their 70s, 80s. They used to use this drug to help with preterm labor. And so their daughters are inclined to develop cervical cancer, but a different type, not the one that is caused by HPV. And I think I've seen maybe 1 or 2 cases of clear cell carcinoma. So there's a very small subset. And also 2 persons who are immunocompromised are at risk, and immunocompromised due to chemotherapy, diabetes, organ transplantation on immunosuppressant drugs like steroids. Those patients are also at increased risk of developing cervical cancer. So I think it's important I could talk about cervical cancer for a very long time. But those are the facts I need women to know about, and mainly that it's a preventable cancer. And women do not get their pap smears as often as they should. Now, I do understand during the pandemic, a lot of women were unable to do it, and I understand that. But I have had a patient who told me she hadn't had a pap smear in 34 years. Not because a lot of times one of the things you should do when you're pregnant is to do a pap smear. And so most women will do it during pregnancy, and then after that, they don't bother to do it anymore. And so it's important, and pap smears start from age 21 to 65. Okay, so if you're sexually active before 21, it's still not a part of the guidelines to do pap smears at an early age, because a lot of young people are sexually active, and they will come up positive with HPV. And so managing kids from age 15, because the management of an abnormal pap smear is basically a lead procedure or cold coagulation. The lead procedure basically lasers off the abnormal cells on the cervix. So if you continue to laser off cells and cut off the cervix in young people, then it's going to be an issue when it's time for them to have kids later on. So the recommended age is 21 years. My thing to you is to be screened and get your vaccine to prevent against cervical cancer. So you can catch the pre-malignant stage. Now for the month of January, I, along with my office, we run a campaign to get screened. And so for Cervical Cancer Prevention Week, which begins on the 23rd of January, my office, Femina, will be offering Pap smears for $50, and basically that's the cost of the lab. So that is my give back to the Bahamian women every year. And I do my Pap party every year just to get women to screen, basically. And this year also too, I'm still in the process, but I'm trying to see if I can, to get the HPV, the Gardasil vaccine. It won't be free and it won't be cheap. That's another thing. The vaccine is not covered by insurances, and it can be very expensive, and you need 3 doses over a 6-month period. So at least I'm going to try and organize some of the women who come for their Pap smears, talk to them about the HPV vaccine, and see if I can coordinate them getting it at some point. It's very important. Another forum that I'm doing, there's a forum, that I'm doing at Fusion Superplex on the 19th of January. And basically, it's a talk about cervical cancer, similar to this, but it will be more in depth. It'll be longer. There'll be a time to ask questions. It starts at 5 with a pop-up. Everything teal, the colors for cervical cancer are teal and white. So we're hoping to get some of the booths to be decorated in teal, and just for persons to have get some information out there. There'll be vital signs monitoring. There will be cervical cancer t-shirts available at my booth for $25. And we just want to have a good time and get as many women out there, men too, to get informed, to get the information out there. And there's a sip and paint if you want to. That's another opportunity to learn about cervical cancer. That'll be at a friend of mine at her home. And at this particular venue, it's a paid event, $50, and it's a sip and paint. And it's, again, another opportunity to learn more about cervical cancer. But at this particular event, you'll be able to chat with me up close and personal, not just about cervical cancer, but about anything female relating to anything, abnormal bleeding, whatever. So it's almost like a mini consultation. So that is on the 22nd. That is the Sunday after the Fusion event at 4 p.m. And then from the 23rd to the 28th is our annual Pap party, where we'll be offering Pap smears from the office from 10 a.m. to 5 p.m. And the price is $50. And we'll be having drinks, wine, cider, just to say I appreciate my Bahamian women, and I want to encourage them to get papped. Have a few like this open forums. I have a recording. I asked the doc. I did a recording for that. That should be airing on Tuesday evening. I don't know the exact time. Anyway, I have my Facebook page for MENA Bahamas should have all of the information. I also have a menopause page. I'll be posting all the information there. It's called the Menopause Lounge. I have a PCOS page. It's posted there, PCOS Transformed. I have a general page called Woman Self Tips and Q&As. It should be there. And my office cell is 804-0414. You can WhatsApp me there if you have any questions about any of the events. So thank you so much for listening. And I hope that during the month of January, we have a couple of weeks left, that you guys will be perfectly packed. Thank you.
Hold on, don't go anywhere. I lost internet during the broadcast, but it continued. That's the beautiful thing about Zoom. And this computer is glitching, so I just got back, borrowed some internet. No joke, it's crazy.
Oh, wow.
Yeah, so I lost, I couldn't hear you for quite a while, but I'm back, praise God. I don't know if you can see my camera's just glitching. But nevertheless, I want to just say thank you, and I would like to open the opportunity for persons to, I'm going to open the floor a little so persons can ask questions or to make comments. And we just say thank you so much, Nina, for educating us on the various different types of the reasons why people get cervical cancer. It's such a stigma attached. You know, as I was a young mother, and Dr. Culmer would say, Marlene, you have to get your pap smear, and everything was fine. I'm like, praise God, because, you know, there's such a stigma. And I know, because as a young lady, we know, you know, and you hear somebody got it, like, oh, you can imagine what kind of person she was, or she is, you know what I'm saying? So I'm so appreciative that you shared that aspect of it. And I think that I know you sufficiently to say that if you need a gynecologist, I think she's the person that you'd want to go to. Very gracious, very tender, very gentle. I took my daughter-in-law to her last year, and she was very comfortable. And the baby's here, just came in last night for the first time I'm meeting the baby. That's right. That's right. That's right. So
tell them congratulations for me.
I will, you know, so they're here, and, you know, so I feel very, very comfortable with Nina, very comfortable, and I may make her my gynecologist. I actually need one. So yeah, let's do that. You know, so I want to encourage you to attend the event. What day is that next week? Thursday? What time?
5 p.m. The pop-up starts at 5 p.m.
5 p.m. And it's at the gallery, not gallery.
Fusion.
It's the Fusion.
And it's free, guys. It's free. The mix and mingle starts at 6. So a few hors d'oeuvres and drinks starts at 6. There's also a catch bar. And at 7 o'clock, I start my talk. Hopefully, I'm hoping that the Prime Minister's wife is there. I'm not sure, because there's a mandate on the Office of the Spouse of the Prime Minister to, it's a United Nations initiative, a Sustainable Development Goal number 3, to eradicate cervical cancer by the year 2030. Okay. So we have 7 years to try to make this happen. And I'm hoping that maybe she can come and talk on that and encourage the women also. So yeah.
Very good. Any questions?
Yeah. Any questions for me?
Any questions for Dr. Nina? This will be the time.
Good morning.
Good morning.
When is the best time to get a pop?
Meaning the age?
No, I mean, like anytime, like if there's a specific time, or you can go at any time.
Well, it's best not to go when you're having your menses. But other than that, there's no specific time. Now, back in the day, they used to do the conventional pap where they would use the spatula and the brush and smear it. Now, well, I think they still do that in the government sector, but now we do what we call thin prep, where the brush is placed in a solution. So if you have minor bleeding or minor discharge, a small mild discharge, then it's still, you can still do your PAP because it's now dropped in a solution, and all of the cells that need to be, that goes into the solution. So it isn't as bad as actually smearing it on the glass slide and spraying it and fixing it as we used to do back in the day. But like I said, in the government clinics, I think they still do it that way.
You mean to tell me, wait a second, that uncomfortable feeling I used to get when I go and, hold on, so it's not like that anymore?
No.
Hallelujah.
As a matter of fact, some women be like, "Oh, you finished?" And I'm like,
That's a job clinic. That's a job clinic.
yes, but most of the private offices probably do thin prep. And like I said, I'm not sure if the government clinics are doing it now, but because the thin prep is a little more money, but I know the private doctors should have a thin prep.
Okay, so what's your clinic visit like? Because sound like I become to your clinic.
Well, I have some special hours, even though on my door it says, a full clinic from 9 to 5. And initially, that's how I wanted it, but I am still fully employed by Princess Margaret Hospital. So some days I have clinics there that I have to go to, and then I rush to the office and stuff like that. So it would be best to WhatsApp me at 804-0414. And I will get back to you in terms of an appointment date. If you say, and I am open on Saturdays, by the way, for now. Just WhatsApp me and we'll get you on I'll get you an appointment date when I'm there. Mondays and Wednesdays are usually the better days for me. Tuesday mornings, I have a clinic. So I have an afternoon clinic on Tuesdays. Thursdays, I'm in theater. Fridays, I'm at Family Medicine Center. And so, and Saturdays, I'm at my clinic.
Okay, Miss Marlene, you gotta drop that number in the group.
Her numbers are, can they use the same number that's in the group, Nina?
The 804 number?
Hold on, let me see. I'll tell you which one is there.
I think I have my personal cell.
Okay, give me the number again. I'm writing it, typing it now.
It's 804
04
0414.
04, sorry, 804 0414.
Yes. And the office, well, when I'm there, the office line is 698-0414.
698-0414.
Yeah, that's the landline. If I don't answer you right away, I'm probably with a patient or I'm in theater, but I will get back to you probably within the hour.
Okay. I'm just typing. And I'm going to tag you in this. I'm just putting the numbers there, guys, with just a quick tag, okay? Anybody else with a question for Dr. Nina?
Dr. Graham.
Hi.
Okay, can one have cervical cancer after they've had a full hysterectomy?
No, because the cervix is no longer there. But a lot of times patients who have had more than one abnormal pap smear, they usually come to me. I'm tired of doing all of this colposcopy, the biopsy, and all this stuff. Just take it out, right? And once we determine that they don't have cervical cancer, we tell them yes, we can do a hysterectomy we can do a hysterectomy and take out the cervix, the uterus, the tubes, and the ovaries. But I do counsel the patients that if you have a persistent HPV infection, and of course, in the older population, it's difficult to clear the virus as opposed to the younger population. And so some may have a persistent HPV infection. And I always tell them, don't go beat up your husband. You could have gotten that from your first sexual encounter. It's difficult to determine. So if you have a persistent infection, that stays with you. That's how viruses work. Now, HPV is a little different in that you can clear it. But once it becomes persistent, it remains in your system. And so you may come to me, have a biopsy, and if you need treatment to prevent cervical cancer, we give you that. And you're fine for like 5-10 years. And then all of a sudden, it comes up again. Either you're stressed, you're going through something in your life or whatever. Different things cause it.
Mhm.
And so I have to tell them that if you have a persistent HPV infection, the HPV can, because it's in your system, it can also affect the vagina. So even if you take out the cervix, you can get cancer of the vagina, of the vulva, okay? But those cancers are less common than cervical cancer. So, but there is a chance that you can develop. I have a patient that had that we managed and everything, and she came back with a vulva cancer. Okay, and that's why I mentioned the HPV affects the female genital tract, including the vagina and the vulva, and the anus and the throat for persons who engage in oral sex. So now they're seeing that smoking is no longer the big thing that causes throat cancer. It's HPV. All right. And so I tell women, and I encourage them, even after they do a full hysterectomy, you should still do a Vault smear. A Vault smear is a smear of the upper vagina. All right. And especially if the patient comes in with some bleeding and they be like, well, I know I don't have a uterus, but I have some bleeding, you know, it could be coming from it. I don't know. It could be coming from the vagina. It could be coming from the anal area. Okay. So, geez, what was your question again? If you need to get a pap smear after having a hysterectomy, right?
Mhm. Yes.
Right. Yes.
Good
I do
morning.
encourage some doctors will say, oh, you don't need to do a pap smear no more. I have worked in gynae oncology for more than 10 years. And I still have my patients come back to do a Vault smear. Up until the age of 65, that is. Any other questions?
Yes, good morning. My
Morning.
question is, if you do your pap smear regularly, would this
Yes.
HPV infection show up during a regular pap smear?
The HPV, no. The HPV, when you have an abnormal pap smear, usually in most cases is caused by an HPV. And for a person who wants to know if they have HPV, you can do HPV status on the same thin prep. So the plus of doing a thin prep is that you can do your screening and you can find out what your HPV status is. So for women who come to me for their annuals, especially the younger women, I encourage them along with the general bloods to do your annuals. Of course, it's going to be, it's going to cost more because insurances normally cover certain investigations. But for women who are of a younger age group, I encourage them to do an STI panel. Where you can do your general, chlamydia, gonorrhea, syphilis, HIV, hepatitis. And I encourage them, I say, well, we're going to do the pap smear. And, well, if the pap smear comes up normal, then I would know that they have HPV, or if they want to do the HPV testing separately, then they can do that also, and herpes and all of those things in your STI panel, right? But for women, see, HPV is silent unless you have the subtype 6 and 11, where you can actually see the warts. But other than that, the only thing that can tell you that you have HPV is a pap smear. And for men, unless they develop penile cancers or anal cancers, they don't even know they have it. And there's no screening for men. I see I have a man in this group, or I don't know if Troy is a man or a woman, because sometimes they have
It's a woman. I don't know if
see?
I don't know if any of the men are here. We do have men. I don't know if any of the men are
Good
here.
morning. I'm female.
Hi. I got excited when I saw Troy, so I was like, oh, goody. because they need to know also. But of course, you guys can inform your husbands and partners and stuff. So, but I was getting excited. But yes, men don't know they have it. Okay, and there's no way to screen them. Only us. Okay, any other question? I hope I answered the lady's question.
Yes, good morning. So it isn't true that the HPV originates with men, or it is a sexually transmitted disease?
It is. I mentioned that earlier, yes.
Okay, with the cost of it, does the NHI, does that help out with it? The National Health Insurance?
That if it helps with the screening?
Yes, with the payments, because you said persons die as a result of not being able to pay.
Oh, the NHI will cover the screening, like in your annuals. But no, I don't think, I'm not sure if NHI, because the oncology clinic where I work, that's a paid clinic. A lot of persons know that PMH free, right? So they come and they, but I normally call the patients before the clinic, and if they have to do a biopsy, I said, listen, this is like $200 and some to do the biopsy. It's not a free thing. And so I know that if you have private insurance, you can apply that to like if you come to the clinic. So I'm sure you'll be able to do that. Now, NHI, I'm not sure if it covers the treatment, because radiation is like $15,000, of which the government, at least that was some years ago. I don't know if it has increased, but because radiation is not done at PMH, they have to hire a private entity to do our radiation, and so the government foots most of the bill, but not all of it. And that's why I was mentioning, I have women have died because they couldn't afford the extra $5,000. And so the cancer grows, and then it impinges on the pelvic side wall, and then so the tube from the kidneys to the bladder basically cut off, and the patient develops renal failure. That's one of the ways women die from cervical cancer or complications of cervical cancer.
Thank you.
Any other questions?
Morning.
Morning.
I'm trying to find out, okay, if you're never sexually active, is it recommended to do a pap smear?
At 21, yes. Yes, ma'am. Now the thing is, women, or I should say, persons have, well, that's a kind of up in the air, but young people and the younger population say they're not sexually active, meaning that they have not had penetration, but they do other things. They have oral sex, they have anal sex, and so the human papillomavirus affects, as I mentioned, all of those areas also. And so we still recommend that that you do your pap smears even though you're not sexually active, because it's very difficult to define sexual activity these days. Now, if you have not had sex, like in the proper sense of the word, then maybe you may not need to have it as early, but at some point you're gonna need to have it done. Persons who have not had children and were never sexually active actually are more prone to a different type of cancer, which is uterine cancer. And I didn't mention this, but all of the cancers of the reproductive tract present with bleeding. And so if you're going to be investigated for abnormal bleeding, a pap smear and a biopsy may be one of the things they do anyway. So to answer your question, if you're not sexually active, and then sexual activity, you may say, I'm not sexually active. But that may be, I haven't had sexual activity in 10 years, so I'm not sexually active, or I haven't had sex in 5 years, so I'm not sexually active. But have you ever had sex in your life? Because you can contract the infection from your first sexual encounter. So, you know, if a patient comes to me and says, I'm not sexually active, then I got to probe a little deeper and find out if that is indeed the case, or your definition of sexual activity is different from mine. I hope I answered your question.
Yes.
Okay. Any other questions?
Yes. Good morning, Dr. Graham. Thank you for your presentation. I have a question. Can you be cured from HPV?
Wow. If the infection it can be cleared, I should say. Meaning that usually when I do a biopsy, and I usually follow my patients for 2 years. I mentioned earlier that the HPV can be cleared from the system in patients who have a good immune system. But as you get older, your immune system may tend to be reduced a bit. So yes, it can be cleared, but it's nothing that you do specifically. I definitely, to increase your immune system, your diet and your lifestyle is where that comes in. So if you're going to clear the virus, you can clear it. But there are some patients of which the virus is not cleared. And that patient, we call, have a persistent infection with the HPV, meaning that it's in their system for forever. And but what we do is, what it causes, we manage. So it's like HIV. All viruses, or the persistent HPV infection is like HIV. Meaning that you don't get rid of HIV, the virus, but if HIV causes a pneumonia or it causes some infection, you manage what the HIV causes. So in the case of HPV, if you have a persistent infection and it causes an abnormal pap smear, is when you come to me, I biopsy, I confirm, And if you're at a stage where you need treatment, then we manage. We either burn off the abnormal cells, or we heat the abnormal cells, or we do what we call a cone biopsy and cut a big portion of the cervix out. That is the way that the patient is treated. And the patient is followed up for a several amount of years. So to make sure that their pap smears are normal. But the virus is still there. And due to various things, stress or anything like that, they haven't really identified things that may cause it to pop up again, but it can pop up again. And when it pops up, the question is this an old infection, or do you have a new partner and this is a new infection? It's difficult to say, because when you do your HPV status, it doesn't tell you which subtype you have. All right, it could tell you if your infection is that you have, that the infection or the HPV is there. But to pinpoint exactly when you got the infection is difficult to say. Any other questions? I hope this don't mean y'all ain't coming to my event on Thursday, you know.
I will be there. I will be there.
I give it too much information, and then
No,
the simple thing.
I think that what happens
close
is
and personal.
no. I think that this should really encourage people to come, because it's very informative. I've been, so blessed by your being here, and I can tell that they're blessed because no one's leaving, in spite of the fact we're getting ready for work. People are still here. So,
We'll encourage family
I
members
totally
and
agree
friends
with
to
you,
come.
Marlene. Nina, listen to me. So I go, well, I ain't doing nothing, so I good, and then you come with, oh no, you need to get checked. So this is an awesome introduction, Nina, for Thursday.
Great.
And you should see me voice noting. I'm like, girl, we need to go to this thing because Nina talking and she's saying, so I'm telling you, I just voice note too, because knowledge is power.
It is.
Knowledge is power. And, like Marlene said, I'm sure there's a stigma to whatever, but we just don't know.
Yeah.
Because we've we just don't know. But,
and a lot of women, like I say, sexually transmitted infections from HIV straight down to the ones that can be treated, like chlamydia. A lot of times it is stigmatized, and for those reasons, women don't go and get checked. Okay, and I mean, it is unfortunate, but you have to take the bull by the horn and deal with it. I have had patients who I have diagnosed them with precancer cells where they could have been treated, and they left and never came back. And when they came back, they had cancer. And I was like, where you been? And the first thing I tell my patients with abnormal pap smears, because they think they have cancer, I say, you do not have cancer. Let's deal with this now before it becomes cancer. And for some people, they just disappear. And then they do the natural thing and all that kind of stuff, even with early stage. And this isn't just for cervical cancer. This is for all the other cancers of the reproductive tract. God bless her. Another patient of mine, I diagnosed with uterine cancer about 2 years ago or so, and she refused to do any treatment. And she said she was doing it natural, did something once. I said, okay, so did you get another CT scan to see if it progressed or anything? No. I said, but so how you? And then by the time she came back to me, it had spread. And I lost her a month ago, in December. And I was so hurt. And up until up until it spread, I say, you sure you don't? And she just disappeared. So ladies, be proactive. Please be proactive. And the pap smear is, yeah, it's uncomfortable, but it's not bad. And with the thin prep, it even makes it much better.
Well, Nina,
Got
hi,
to
I'm
be
in the
pleased.
US and I just want to say thank you. I will be calling and making an appointment this week. I won't be able to come to the Sipmanty, and I would love to do that. But since I'm in the US, I won't be able to make it. But thank you. Very informative.
I can
very-
take you virtually. I
You're
can take you
welcome.
I can
All
take
right.
you virtually by phone.
But this has been very informative.
I do telemedicine, but in terms of counseling because before for a lady who has an abnormal pap, I do have to have an initial consultation with them to discuss what their results are and to discuss the way forward, the further management of the patient. So the initial consultation can be done via telemedicine, but when you have to really do the biopsy, of course, the patient has to come in. But yes, well, thank you so very
One
much.
question came in privately to me. Somebody didn't want to mention their name. Is it possible to have an abnormal pap smear, then when retested, it'd be normal? That's the question.
Yes.
Yes, okay. All right.
Yes, there's one of the results you may have is something called ASCUS, ASCUS. ASCUS is, I always say that's a diagnosis on the fence. And it's a diagnosis that you can get with a yeast infection or BV, you can get an ASCUS. And so if you had a HPV infection, normally, in the person who's going to clear it will clear it in about 6 months to a year. So if you're ASCUS, and you have an infection, then and you treat the infection and repeat it, then the pap smear should be normal. Hence the reason why we do your HPV status, but it's only done in patients who are 30 years and older. And your HPV status basically says if you have HPV or if you don't. So if you have an ASCUS, which is a diagnosis on the fence, and maybe you have a yeast infection, but you still want to know. For persons younger than 30, we'll just repeat the pap smear in 6 months, because that's about the time the virus takes to clear, if it's going to clear. So some women don't want to wait for 6 months, right? And so we can do their HPV status. Once their HPV status is negative, we can safely say that your ASCUS is not due to HPV, but due to maybe an infection or something else.
Mhm.
So yes, you can have an abnormal pap smear, and the next one be normal in certain cases. Any other questions? I soon have to go to school. Yes.
Dr. Graham, I just have a comment for you.
Yes, ma'am.
It's so ironic that on the same date you're having your on the 19th.
Yes.
19 years ago, you delivered my baby. By C-section.
Oh. Oh wow! I would love for you to send me a picture of your grown child now.
Yes, she's gonna be 19 on the 19th.
Oh, it warms my heart. I have people who stop me outside and in the hospital, and they have their child with them, and you delivered my baby, and I was like, oh, and I get to see them, but I'd be like, oh wow, I get really old.
So I have to be there.
My pleasure. Oh wow, that's wonderful. Thank you. Any other questions?
I don't have a question, but I also want to share that you did my LEAP procedure about 3 years ago. So I can attest that if you do get checked early, it's worth it. So when your pap smear comes back abnormal, she sits down with you. She's very thorough. She breaks it down. I mean, in her personality, you got to meet her for yourself. But when I got checked again, they were gone. So I'm a testimony. Ladies,
Great.
go out, get checked.
Oh, ma'am, you need to, you don't want to talk to my thing, eh? Or there will be some time for questions and stuff. Hopefully, I think Hope Shelley-Ann is supposed to help me with that. So it'll be very good if you're there to mention that to the women, because it's always good. Me sitting there talking and giving you all the information in the facts is one thing. And then I know last year, a year before last, I actually had a cancer patient that was managed by the team. And we had an event for All Cancer Month in May 2 years ago, where I did an event called Light Your Lantern. And she spoke, and that was very effective with the women also. So hearing it from other persons. We also had a nurse speak, so who works in the oncology clinic, who see, women with cancers and getting chemotherapy and so forth. So it's always good to hear from other people or to see what their experience like. Now, I must say, don't go to your friend and find out about a LEEP procedure or a colposcopy before you come to me, please, because I always tell women, every woman's experience is different. So I have women, some don't come back because their friends tell them whatever, and some come so terrified that the minute I put them on the bed and start to put in the speculum or the clamp, like persons call it, they jumping off the bed and they scared and they don't allow me to do my work. So sometimes it works against you, but in cases like this where you have a good report, then I encourage that. And I thank you very much for your comment. And I am very happy that you were comfortable with me and that I made a difference.
Amen. 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 Beautiful. And
Okay.
Nina has to go.
Yes, I will see all of you guys.
So
on
then
the 19th.
obviously, even after your event, you can plan to come back following week. I see that the ladies are very grateful. So,
Yes.
I will be in attendance next week, Thursday. I'll be there.
Oh, great.
And
I have no problem talking. Like I tell you, Marlene, I'm very shy, believe it or not. But I have gotten a bit better, because on my social media platforms, my Facebook platforms, I was encouraged by those to do Facebook Lives. So on my Menopause Lounge platform, I've done 2 Facebook Lives. And on my PCOS Transform page, I did 1 Facebook Live. So I'm getting out there a bit, but so and this one now, I'm getting a little comfortable.
Did very well.
Thank you.
Very, very good job. Excellent presentation.
Okay.
And I'll give you a call later.
Yes.
Once again, give us your schedule. Once again, give us the schedule. When you are there at your office on Saturdays, that's for sure.
Yes,
any other time?
Mondays and Wednesdays, I'm usually there full time.
Okay.
And Tuesday afternoons, because I have a clinic in the morning. Thursdays, I'm in the operating theater. Fridays, I'm at Family Medicine Center. Yeah.
What you can do, how about if you can share that with us in the chat? Your schedule, please.
Okay, what I'll do, because I'm running out like a bottle.
I know, but you can do it later. You can send it to the chat.
Yes.
Give us the schedule.
Okay, I will, and I also will again. If you can share the flyers for the Thursday event. I didn't send the flyer for the.
I did. I sent it already. I sent all of them in the chat just now.
Right. No, I didn't send the one for the sip and paint, and I don't think I sent the one for the pap party.
Yeah, so, I have mix and mingle, pop party, and sip and paint.
Oh, great. Okay, wonderful.
So let's put it this
All
way.
right.
It has upcoming events and Sip and Paint is one of them. I don't know if it's actually, yeah, that's, so I have
Yeah,
3 of them.
I gave,
Yeah.
right. I did a calendar of events, but
Right,
I
I like
I
that.
have individual flyers for
So
each.
that's the
for
pop.
each of them.
That's the pop party.
Yes.
And then this is the Sip and, sorry, the mix and mingle.
Right. Okay,
Right.
so I didn't do the sip and paint. All right, I'll get those over to you though. Okay?
Feel free to share them in the chat yourself, baby girl. Hallelujah.
Okay, okay, I
All right.
will. Thank you.
Thank you so
All right.
much. And
You're
do give
welcome.
Israel hello for me. Tell him I gotta make one pan of macaroni one day.
Wonderful. You know he missed them, right?
I know. Tell him I can do that just for him one day soon.
Wonderful.
Thank you so
wonderful.
much again, Nina. You know you have to leave to
Okay.
go to work. And I just want to say thank you on behalf of all the ladies who didn't get a chance to even share this morning for coming. And we wish you a very beautiful day, a blessed day, and a prosperous new year.
Thank you. Same to you guys. Bye-bye.
All right, guys, we thank Dr. Nina for stopping by. And if you are watching by YouTube, we hope that you will take this information and that you will share it with your friends and family as well. Take it, share, because sharing is caring. She spent the time and shared with us. And we know that it's because she cares and she's a doctor that really cares. You hear the testimonies of persons who are here who have used her services and know that she is definitely somebody that you can trust and appreciate. So I say to you, if you need a gynecologist, OBGYN, if you need a gynecologist and you live in this country, and she said she does do by phone, or video call. So if you live anywhere in the world, you can definitely give her a call. All right. So I'm going to close it on our YouTube channel.